Patient's Cataloging System, PACS. Okay, so this is an MRI.
Whose is it?
This is you. This is you.
Okay, wow.
All right?
Oh. Sit there because my neck is going to explode in a minute.
Yeah. Okay. So this one has some findings, okay? I wish I could turn it better for you. But
No, that's okay.
so this is a T2 rated image, which is an image that's fluid sensitive. And one thing that it also shows, besides fluid sensitivity, is blood vessels. So the blood vessels are these black spots here, here, and here. Do you see? You're on your back. This is the back of your head. This is the front of your head. That's your nose. These are your eyes. Okay? That way's right, and that way's left.
Okay.
So we're looking at a slice through your head in the like this axial plane. Okay? Now you've got blood vessels that come up
through the neck.
Through the neck, and there's 4 major blood vessels. There's one right vertebral artery, which is here, one left vertebral artery, which is here, and then one right carotid artery, which is here, and the left carotid artery, which is here. And those 2 vertebral arteries that I pointed at before, they fuse in the midline to form the basilar artery. Okay, and that's what this is. Now you see that's the basilar artery that's normal size. Okay? If I go up a slice, oops.
That's where. Yeah.
If I go up from there, that's normal in the middle, to there. See, it goes from big to small, and then the next slice goes big again. So that narrow slice is the narrowed portion of the blood vessel. And we call that a stenosis. This is a different sequence, a flare sequence, that's not going to show us the important finding that I want to show you. This is the axial flare. This is a good way to look at a good view of your whole brain. You have a few little bright spots. We call that chronic microvascular ischemic disease. Everybody gets these as they get older. You have a good-looking brain for a 70-year-old woman. Looks really good, actually.
It does?
Yes.
What was that little line there?
Which line?
And the one, yeah, those things on each side.
These black lines?
No, not the white ones.
These?
Oh,
Yeah,
your
no,
skull?
this
This is your
one
skull.
that was very prominent.
You show me which one.
Well, click it.
Well,
You tell me when to stop.
No, but that wasn't the flag. That wasn't. You clicked several images.
Oh, these bright spots here?
No, it was on the side, coming in like that, like 2 arrows shooting out. That. What was that?
That?
No. Well, it
That?
must not be important if you
Yeah,
don't see it.
I don't see anything other than the stuff I pointed at you. This is a side view.
Okay.
Okay, now this is your nose. You're looking that direction. Okay, the back of your head is back here. This is your neck, and your spinal cord is right here.
Okay.
And it goes up, and this outpouching is called the pons.
And why is it so dark? Is that normal?
This is a different sequence. It's a T1 sequence, we call it, and that means that fat is bright and fluid is dark. Hey, Raj.
You beat me to the punch.
Dr. Verma's here. She wants to see her.
Decisions.
I'm going to show you where the stroke was,
Okay.
because that's going to be the only other thing. This is another one that shows the blood vessels again, but you can see here that your basilar artery gets pretty small right there.
Yep.
And then it's normal right there. So that's the area where it's narrowed. And then when we look at the diffusion scan, you'll see that this is the diffusion scan. So this is the scan that shows where strokes are. So
Okay.
things that are bright on this scan are stroke. Just trying to window it properly.
What's those 2 lines?
So that's this is This is it right
Those two
here.
white things on each side. Is that my eyes squinting?
No, that's artifact. That's an artifact of the scan. But this bright spot right here,
Uh-huh.
that's a little bit of a what we call a diffusion restriction. Oops. And that means that there's a little bit of a small stroke right there. And even though it's small, it's symptomatic because it's a very critical area of the brain.
Which it affects what? The speech?
All of the paths that go from your brain to your body pass through the brainstem, which is what, or the pons, which is what that is.
Uh-huh.
The way we treat that kind of disease is with medicine.
Medicine.
We treat it with aspirin and Plavix, which are for platelet blocking. Platelets form clot. So we're going to block your body from forming clots by giving you aspirin and Plavix.
Yeah.
And we give you a statin, which
Uh-huh.
you're on Prevestatin, which is a medicine that lowers cholesterol, and it also has some anti-inflammatory effect that we don't entirely understand, but we know that it reduces your risk of stroke.
Okay.
And that's what Dr. Verma's treating you with all those things. If you were to have a recurrent stroke or TIA while you're on those medicines, there are other things I can do to help you as well. So I can open up that blockage mechanically with a balloon. We inflate a balloon and open it, and then we put a stent down to hold it open. But that's unlikely that that's going to be necessary because I expect you to 100% respond to the medicines.
Right here, this area. Very
But what I'd like to do is get you set up to treat your aneurysm in a couple weeks.
Yeah, that aneurysm business. That's the bad part, right?
Well, I don't think it's the bad part actually.
No?
I think that we're going to treat it and it's going to go away and be gone and not ever bother you again.
Really? And what you're going to coil that thing in there?
Yeah. Mm-hmm. So the way that we do that is we bring you out. You're already on aspirin and Plavix, which is what I need you to be on for the procedure. Have you come back in a couple of weeks?
Did I get a pill this morning?
Yes.
I did?
Well, if you haven't gotten it yet,
no,
you're
you
gonna
have
need
not.
it.
You're going to.
It's just a once a day aspirin.
It's
and
in the
once a day
morning.
Plavix.
Yeah, it's in the
At the
morning.
same time
And
you
then-
take it.
You can take them any time of the day as long as you take one a day.
Okay.
And then we bring you back in 2 weeks. I want to test your blood to make sure that those medicines are working. Not everyone responds to Plavix. Some people it doesn't work. So we're going to make sure it's working. Some people are too sensitive to it. It works too well. So based on that test result, most people do respond. I expect you to respond. And then after we get that normal blood value, then we'll treat you the next day. We bring you into the hospital in the morning, early in the morning. It's an outpatient procedure though. I mean, you come in, the nurses check you in, put in an IV, talk to you about the procedure. Then
Yeah, like that
anesthesiologist comes in and talks to you about what they're going to do. And then we bring you back into a room. It's like an operating room, except we have x-ray equipment that rotates around the table. We put you completely to sleep. We put a drape over from your chin down over your feet, and there's a hole over your groin in the drape. Through that hole, we puncture the artery in the leg with a needle, and then we put a wire through that and exchange that and for a little sheath that
Okay,
holds the
on
blood
which
vessel.
is the right or the left side? You
It
know?
just
Either
depends.
side. But
Well,
most
can you-
likely we go, because I'm right-handed, I usually end up going through the right groin.
Because I have sometimes I just need to tell you things and I don't know what it is, and I wish you would order a sonogram on the area, because sometimes I have an excruciating pain in the groin. And I
Okay.
think, my God, what is that? And that has started about 2 months ago.
Hmm.
What could that be?
It kind of sounds like a hernia. You can have hernias in that
Well,
area
will
that can
that show
cause
with
pain.
a sonogram?
Well, we might be able to feel it if we just look.
No, there's nothing. I looked and looked and looked. There's no protuberance, there's no caving in thing, but you're welcome to.
Well, sometimes when we know what we're looking for, we can find things that you can't necessarily find in your own.
Okay, so I don't need a sonogram?
First, we need to look at it and
Okay,
examine it, and then
okay.
we'll see if you need a sonogram or not.
I don't know why that is that terrible. I mean, I'm surprised at the pain, because usually I'm, but when I say excruciating pain, believe me, it's bad.
Yeah.
And then it just goes away after a little
Yeah.
while.
A hernia can come down and go down in the groin and be compressed there, and then it can
Yeah.
spontaneously go back and go away. That's why you have to know exactly what you're feeling for, and usually it needs to be done by another person, not by yourself.
Oh, okay, okay, so when
Okay?
can you do that to find out? Because wouldn't that be terrible for you to put that thing in?
We'll have to have
Right through the-
Dr. Garcia, the medical doctor who's taking
Okay.
care of you in here. I'll talk to him about that. 'Cause
Okay,
he's more
please.
experienced at looking for that stuff
Okay,
than I am.
okay, okay.
And
That's
one way or the other,
the
we'll go
only
into
problem I
one
have.
groin or the other, and then we put a little tube in to hold that vessel open while we do the procedure. And then, just like you said, I showed you on the video, we're going to put coils into the aneurysm. The procedure takes a couple of hours, and then afterwards, we wake you up. You stay in the hospital one night in the ICU so that we can make sure that no
Nothing.
negative
Right,
side
well,
effects
yeah,
happen.
that 1% thing, yeah.
Exactly.
that-
And then the next day you go home.
Okay,
And then I'll have you come back and see me a couple weeks later just to make sure you're not having any problems. And as long as you're doing well, then I'll just see you in 6 months for that follow-up angiogram to make sure there's no recurrence.
and is
Okay.
there any change in the eating habits?
No, not from my perspective. Although it's always good to eat
Well, I've
a
been
diet
doing that,
low in
that's why I'm so
saturated fat,
surprised.
low in cholesterol,
Yeah, I do that.
cholesterol. Watch your salt intake so that
Oh,
you
the
don't.
salt? Yeah,
I'm
love
just giving you
salt.
general
Yeah, I'm
good
just
advice.
surprised.
None of this is specific
Right.
to my field.
No.
Because, I mean, I don't know why, I eat so healthy, and I don't eat sugar, and I don't eat ice cream, and all that stuff, and I'm always saying, don't eat white bread, and don't eat corn, and all that stuff, and here I come and get that stuff, and my sister eats a bucket of ice cream, and it's that big, and all her cartilage is shrunk. She was like 5'10", and now she's 5'2", I think, because she's just, destroying herself, and she's as healthy as she can be. It's ironic, isn't it? I mean, it's...
Well, you generally you're very healthy for 7 years old.
Yeah, I'm gonna be 71 now in a month.
So
So I don't know.
Yeah.
we just
see
got
that.
a few problems that we all get as
So I
time
can live
catches
to
up
a
with
ripe
us.
85.
That's correct. You just need to take aspirin and Plavix and a statin while you do it.
Yes,
Right.
that's the very
That's a
important.
statin. That's a statin drug.
A statin
Is
keeps the cholesterol
Right.
keeps the cholesterol down.
So do you have any questions about all that, either of you?
No, I need
You
to
have,
mark this
did I
over.
address everything for you?